Hi, welcome in. How can I help you today? Okay, you want to get your ears checked? Okay. Is this for something hearing related, or are you thinking about getting a cleaning or pains? What are you in for specifically? Okay. So you've been getting some headaches and you think it might be due to your ears? Okay. Do you notice any hearing loss on one or either sides? Okay. It's only your right side? Okay. So all of these symptoms are only your right side? Okay. Do you have any pain like around or inside of the ear canal at all? Maybe a little bit? Okay. We'll definitely check you out. How do you clean your ears? Do you use Q-tips? Okay. Yeah, so when you use Q-tips, I'm sure you know by now, but just make sure that you're not really digging it too far, that you're more just cleaning the outside and the front of the, yeah, you get it. Okay. Yeah, because that pushes the earwax in. Okay. And will you be using insurance today? Okay, what is your provider? Okay. Yeah, normally I'd be typing this down, but our systems are down today, so gotta do everything manually. And can I get your name? Okay. And also your email for our file. Okay. Awesome. Well, I can take a look now. Excuse me, my throat is a little dry. Okay. Let me put on my gloves. So when did you notice this start to occur? Is this something recent, or you've been dealing with this? Okay. Perfect. Okay, I'm going to look into your ear. It's your right, so it's my left. But I will look into both ears, okay? Okay. So I'm just going to look in. Okay. I do see a little bit of irritation as well as some wax in there, which is normal. It's normal to have some wax, but if there's an overgrowth, then that could mean some sign of a problem there. Okay. Let me look again just to make sure I didn't miss anything. Okay. Yeah, so far I'm not seeing anything too out of the ordinary. I am seeing, like I said, a little bit of inflammation, okay? Let me check the other ear just as a comparison, okay? Okay. Yeah, this side has a little bit of earwax, but there's none of that inflammation. So there definitely is something either inside there or something going on in your body internally that's causing that inflammation. So there's a few things that we could do. I can set up an appointment for some blood work. Okay, yeah, you want to do that? Okay, we can get you in pretty quickly. I do, however, want to test your hearing just really quick using my tuning fork. Okay, so I'm just going to try it on this ear first, on your left. So I'm just going to put it near your ear, and I want you to tell me when it stops ringing. Okay. Okay. Yeah, that was a bad one. Okay. I'm pulling it away. Now, okay. Let's try this one. Now, okay. Yeah, so it does seem like one of your ears is able to hear it for longer than the other. Okay, let's put this away. Did I hit pockets? There you go. Okay. Let's go ahead and clean your ear out, okay? Just try to get some of that stuff out that is maybe adding to the irritation as well. There might be something in there that's causing it. So if we can get that out today, that would alleviate a lot of your discomfort, as well as maybe avoiding having to go to any follow-up appointments. Okay, sounds good. So I'm going to go ahead and put some of this spray. It's almost kind of like a lubricant. It's going to help get some of that harder on earwax to lift, so it's easier for me to grab it. Okay, and it will be a little bit cold, but it shouldn't hurt at all. Okay, so I'm going to do both ears. I'm just going to I apologize if you hear my stomach. I actually did have breakfast this morning, but I don't know. Okay, we're gonna go in, and I'm going to get some of this harder on wax, okay? Okay. Let's clean that off. Let me get a pad ready so that we can use that to clean off. Okay, very good. Let's continue. Okay. I think we can move on now to the other ear. Okay, so I'm just going to put my stuff over. this side and okay. I do see a lot more here. It's also kind of a different color. So what I'll actually do is I'm going to send off some of this as a sample to get biopsied, okay? Okay. Tested, not biopsied. Okay. And that could definitely explain the pain and discomfort you're experiencing, okay? Okay, very good. Let's continue. Are you feeling any relief as I do this? Okay, good. Yeah, it's kind of caked in there. Okay. Okay, let's get a sample really quick. Okay. I think we're almost done for today. I'm gonna do a few more passes through just to make sure. I got a sample for lab testing, okay? And that typically takes a couple days to a week at the most. And then obviously we'll call you with your results. And follow-up appointment if need be, we can do over the phone, okay? Okay. Okay. Sorry if this is a little rough. Okay. It'll be interesting to see if this regrows and how quickly, if it does. So I would say, if you can, I know this is kind of weird, but if you want to try using some Q-tips and maybe like writing on them or putting a little sticker that has the day, and so you can collect them and see over time if they continue to get worse. Does that make sense? Okay, good. Let me check just one more time, see how it's looking, if it's any less irritated or anything like that, okay? Okay. Okay. Yeah, it looks a lot better. Again, we're gonna take that sample, okay? So you're good to go for today. I don't think we got your phone number, so let me get that really quick. And then we'll be able to call you with the results, okay? Let's see, where's my... And again, you've never had anything like this before, right? Okay. So phone number. Okay. Very good. well, that will go to the lab today, and I will call you personally when we have the information on what that is, and we can make a follow-up appointment. Okay? Well, good luck with everything, and have a great rest of your day, okay?